Pupillary change, pupil tonus. The pupil is a black hole in the iris that lets in light. Around the pupil is the pupillary border, also called the pupillary ruff. This border is made of nerve tissue and connects directly to the brain through the optic nerve. The border of the pupil is where we can observe a direct extension of the brain and spinal cord. Thus, it represents the activity of the central nervous system. The pupil is light sensitive and lets the brain know when to direct the dilator muscle that comes from the posterior border layer to dilate the pupil in darkness so more light can enter. During bright light, the pupil will signal the brain to direct the sphincter muscle, which is a donut shape just underneath the iris stroma, to constrict the pupil to prevent too much light from entering. Because the pupil connects directly to the spinal cord, it is affected by a change in spinal fluid or by an injury to the spinal cord. Pupil tonus is a term used in iridology that refers to the observation of pupil deformation or flattened sectors of the pupil. In this chapter, we will look at the flattenings of the pupil and areas of the spine that have been affected, pupillary size, and various elliptical shapes. And now we're going to discuss pupil tonus signs. The specific purpose of the pupil is to allow light in the eye. The muscles in the iris structure which accomplish this action is the sphincter muscle and the dilator muscle. When there is a pressure on the nerve root of the spinal cord, such as in the case of spinal subluxation, a reflex action occurs and the pupil flattens across from the area that is serviced by that particular nerve supply. Pupil tonus is a term used in iridology that refers to the observation of pupil flattening and deformation. To the iridologist, pupil tonus can be another means of clarification and cross-check for iris signs found in iris analysis. According to research, by correcting the nerve root pressure in the body, the pupil will eventually return to its corrected shape. So the first pupil tonus sign that we're going to discuss here is called anisocoria. The pupils are of two different sizes. This may show damage from diphtheria, meningitis, or a familial history of syphilis. And remember, these are genetic tendencies. Mydriasis, these are very large pupils. The sympathetic nervous system is dominant in these people. These people have problems with poor digestion, weak peristalsis, little or no appetite, fatigue, and exhaustion. They often have trouble with their urinary tract and anemia. There is a tendency for spastic condition, poor absorption of the minerals, and in women, they may have menstrual cramps. They tend to be very generous, enthusiastic people, but they tend to have adrenal exhaustion. Meiosis is a very small pupil. These people tend to have small pupils all of the time, and that indicates that their parasympathetic nervous system is dominant in the body. These people with small pupils are concerned about getting enough food. They often have feelings of underlying guilt. These people usually exhibit a marked changeability. One day they will be rigid and the next day flexible. Such people often have a slow heart rate and contracted blood vessels. Hippus. Hippus means pulsating pupils, where the pupil will get very large and then very small within a few seconds. They move rapidly from mydriasis to meiosis. People that swing back and forth with physical and psychological traumas when they have this hippus. This can lead to shattered nerves. The constant swing back and forth between mydriasis and meiosis shows a disturbed synergism between the sympathetic and parasympathetic nervous systems, which leads to a rapid consumption of strength. This often manifests in nervous conditions in the body. Here we see the iridology chart, and we see the pupil in the center there. So we're going to discuss now where the different parts of the pupil flatten. And when the areas flatten, they might flatten across the top or across the bottom. So what we want to do is always look at the areas of the iris that are adjacent to where the pupils are flattening. Deformations of the pupil. So first we're going to discuss deformations that are elliptical. And these deformations are very serious signs that are hardly ever seen by an iridologist. But if you see elliptical signs that are going in an elliptical fashion, all of these on this side are elliptical. If they're elliptical, you need to send them to a doctor right away. The first one is the vertical ellipse. These people tend to have impending cerebral hemorrhage or clotting. They may be going to have a coma or paralysis. The horizontal ellipse, this shows glandular disturbances, tendency for depression, motor disturbances, and you want to check the thyroid. The frontal diverging ellipse, tendencies for anxiety and stress, weeping spells, muscle spasms, tendencies towards cerebral hemorrhage. The ventral diverging ellipse, weakness and motor disturbances in the lower extremities, pain due to muscle spasms from the buttocks down. The right oblique ellipse, there is a right-sided paralysis or genitourinary disturbances. The left oblique ellipse is a left-sided paralysis, possibly sexual disturbances, lack of strength and energy in the legs. The unilateral ellipse is where only one pupil is elliptical, with impending nervous asthma. Bronchus on that side of the ellipse is more seriously affected. The unequal pupil diameters, as we just discussed, is called anisocoria. It's a background of hereditary syphilitic damage if there is no history of diphtheria or meningitis. And these have been scientifically studied, but as I have said, if you see this, any ellipses is a very serious sign and they need to see a doctor. Now we're going to discuss pupil flattenings. So if the pupil flattens, and that's these on this side of the chart, an inferior temporal flatness, weakness in the arm and shoulder movement, irritations and possible subluxations in T1, T4, T6, and T7. Those are the thoracic vertebrae in the middle of the spine. Tendency towards cerebral hemorrhage or hepatic, which means liver insufficiency. Inferior nasal flattening, irritation to the sacral lumbar and its associated pathways, genitourinary disturbances, arthritic and rheumatic signs. The superior nasal flattening is irritation and possible subluxation to the cervical vertebrae, possible visual problems, digestive and liver insufficiencies. The superior temporal flattening, possible hearing difficulties. This may be due to the dilation of the cerebral vessels or tumors in the cerebellum. Possible subluxation to C1 through C5. The medial nasal flattening, restriction to breathing, the heart may be affected, possible subluxations to C1, T1 through T4. The lateral temporal flattening on the outside of the pupils shows nervous breathing, possible impending circulatory collapse. The ventral flatness, weakness in the pelvic or lower extremities, possible persistent headaches. The frontal flatness, tendencies to depression, fatigue, paranoia, guilt feelings, possible subluxation of the C1 vertebrae. Flattenings are more commonly seen by the iridologist. So now I would like to review with you the flattenings of the pupil. For example, If you have a superior temporal flattening in the pupil, you want to look at the iris areas just adjacent, which would affect the ears. So you would ask about their hearing or problems with earaches. If you see a flattening in the medial nasal portion of the pupil, you would ask about the bronchus in their breathing and the thyroid. If you see a flattening in the lower extremities, ask about their feet and legs, circulation to the lower extremities, feet, knees, thighs, legs. Here we have a spinal chart. So if you see a flattening in the superior portion of the pupil, you will look at the cervical spine and see how that connects with the organs adjacent. If you see a flattening in the medial or temporal part of the pupil, you'll look at the thoracic areas of the spine. If you see flattenings in the lower part of the pupil, that covers the lumbar area and all the organs adjacent to the lumbar area. Here's another helpful spinal chart that will tell you what C1 through C7, which is cervical vertebrae, means, or thoracic or lumbar. And you will see the areas and organs affected by those parts of the spine.